I chose the carnivore diet because I knew it was the complete way to eliminate everything that he could possibly be reacting to. And I knew I had to get the carbohydrates out of him even more. But the thing that I was realizing was that even though they still had white flour and some sugar in their diet in my house, the natural fats, the higher level of animal protein was actually somewhat treating his autism because it was hiding the fact that he was nonverbal. And that was very interesting to me. Now, I know not everybody's going to respond the same way. Not every child's going to completely come out of it, but there is something to the diet and environmental factors that's obviously triggering my son's autism.
All right. Good morning, everybody. Hope everybody's doing well. Today we have Allie Morgan with us. Allie, welcome. Thanks for being here. I saw you at KetoCon, so I got to meet you there. So it's good to see you again in sort of virtual life. Are you unmuted? I think you're unmuted, hopefully.
Can you hear me?
I can hear you. Well, welcome. Thank you for doing this. Remind me where you're located again.
I'm actually in Virginia.
In Virginia. Okay. Well, you went out all the way out to Austin, Texas. I got to meet you there. So great. Well, I want to just, you have kind of two facets. I know you've sort of had a lot of personal issues that you've been able to resolve by using nutrition, particularly carnivore diet. And you also have a child, I think, that has some issues that we could probably talk about if you don't mind. So yes. With that in mind, can you just give us a little bit of background on you?
Okay. Let me run through kind of quickly here. Basically 18 months old, I developed a viral gastroenteritis. And once that cleared out, I had irritable bowel syndrome. I was treated with the rotational diet, which was the elimination diet that was invented by Dr. Albert Rowe. It was a protein and a non-fibrous carbohydrate. And that's what they treated gastrointestinal disorders with then. About age 6, I started to develop migraines, and I eventually started having some seizures. I had the petit mal, which are the absent seizures, and then I did have some grand mal seizures. By the time I was 8 years old, I was also diagnosed with bipolar type 1, dual swinging, rapid cycling. At 14, I had an emergency appendectomy where the surgeon discovered during the procedure that I had polycystic ovarian disease. And then after high school graduation, I had been an athlete growing up, despite all my problems. I was heavily into sports, soccer mostly, and I started gaining some weight. Obviously, I had some insulin resistance, and that was very obvious during the surgery because I already had polycystic ovarian syndrome. So the way I discovered what my major problem was is that I was working in food service and I had an allergic reaction in the kitchen. I was sent over to the clinic where they had done a physical on me in order for me to work in the kitchen. And the nurse pulled out the chart, and she was looking through the chart and brought the doctor in and said, "Did you know you're hypoglycemic at this point?" Because I had gained weight. In high school, I'm a little over 5'4". I only weighed about 113, 114 pounds because I was athletic. At this point, I weighed about 186 pounds. I started looking into some different diets. In the meantime, about a month or so later, I had gotten results from another exam back that showed I had a little bit of cervical cancer. They were able to remove that. I contacted my uncle because he was the only resource that I had at that point. He, about 1992, had a quadruple bypass, and he had diabetes for years. And the one thing that I knew from my uncle was he was doing some sort of diet where he was able to come off of his insulin. And that was kind of my starting point. So I started basically I could find the Sugar Busters book at the library that I was nearest to. So I started with that. And then I found the Atkins book because that's what he had recommended to me. And in the meantime, the one that I could not find that my father ended up ordering for me, it's my father's brother, that's the uncle, was Dr. Bernstein's Diabetes Solution. And so I started working with basically kind of like the base for the Atkins, because that's how my uncle was describing it. The way I ended up on carnivore was having the digestive problems over my life. Most of the stuff that would keep me under the recommended 20 grams of carbohydrates was stuff that just irritated my gastrointestinal system and just made me not feel really well. Although I was seeing improvements in other areas. I was experiencing weight loss. I was starting to sleep better. I was having better moods just overall, just being low carb basically at that point in time and eliminating the sugars and things. I contacted my uncle to see if there was something else that I could eat that would keep me under the 20 grams of carbohydrates. At that point, he told me that if he went over 10 grams of carbohydrates, he had to use insulin. And so the basis for that was I went back and I said, so what do you eat? He ran through his day and he was basically eating meat. He would have an occasional salad or something like that here and there, but he was basically eating meat. Now, reading through the National Geographic, because that was something that we always had in the house, I knew about the Maasai, and I had learned about the Inuits in elementary school. And so I knew there were groups of people that just ate meat. And so I wasn't really fearful about the idea. The only thing that I always tell people was in the back of my mind is I knew people had been doing this for generations and that they had done it since birth. And I didn't know if I would have a different reaction because this wasn't what I thought was my natural diet from the beginning. But then I went ahead on it. And when I started, my digestive tract really calmed down, it really settled down, and I started feeling the benefits of it. I was actually, for the first time in my life, coming off of medications that I had been on because I had been so heavily medicated. It was unbelievable. I had a few hospitalizations as a teen with the bipolar disorder and things like that. I was coming off of medications because I didn't need them anymore because I was so stabilized. And then I did have a little bit of a gap. I had moved in with my grandmother and I was taking care of her. She had dementia in the last year of her life. She had cancer. And so I'd fallen off the diet. And that's actually when I needed a surgery, which was originally diagnosed as a pilonidal cyst. But later on, when I was talking, it ruptured open. And then when I went to see a different surgeon that my aunt, who's a nurse, recommended. He repeated the procedure. It ruptured open again. I basically had an open wound for 18 months. But during that time, I was talking with him about my problems. And I told him that I had the worst, irritable bowel syndrome flare I've ever had for the past few years. He sent me to a gastroenterologist that was a friend of his. They did an endoscopy and a colonoscopy and found out that I now had Crohn's disease, and that the surgery that he was doing was actually a Crohn's fissure. It was an external Crohn's fissure. It was not a pilonidal cyst. And so that's why it wasn't healing.
Wow.
And I started trying to figure out how to treat it. I found the IBS diet. I found out about fiber and things like that. Fiber wasn't good. And I ended up back on the carnivore diet and healed from the surgery finally. And now my Crohn's biopsies have been negative for over 10 years now.
That's powerful stuff. I want to just because I want to see what was going on with the food. You said you try to keep it under 20 grams of carbohydrates, but the food that you were eating to do so irritated your gut. So what were those things that were irritating your gut that were under 20 grams of carbohydrate?
Well, basically when you were reading through the book and you were looking at low carb things, a lot of them were vegetables. It was, broccoli, cauliflower, just even lettuce a lot of times could irritate my system. Iceberg lettuce could irritate my digestive tract.
So basically a lot of high fiber, low calorie food, basically the stuff that we are often told we should eat to lose weight, which can help in that regard, but just wasn't working for you
And
with
I know
your gut
some
issues.
People, I know some people can add it back and they're okay. They don't have any reactions. I have problems with it anytime I try to do it. It just starts to trigger the irritable bowel syndrome.
Yeah, and it's just, as far as 10 years biopsy or endoscopy, and everything's been normal since then. So there's obviously something's going on. It's subjective. And you'd mentioned bipolar disorder. And I've seen a lot. I mean, it seems like in the last few weeks we've been talking a lot about mental health. We had Chris Palmer on, and another psychiatrist on the other day from the UK. And so I see that all the time. People talk a little bit about the bipolar side of things, if you don't mind.
Yeah, that was one of the things that I noticed being just the low carb Atkins. There were some positive changes, but when I went full carnivore, I always just say, a few days in, that what people refer to as the zero carb zen, I've learned that term now, just really hit, and I mellowed out. I remember talking to a friend of mine, and I remember looking her dead in the eye and telling her, this is the first time in my life that I feel like I'm normal, that I'm a normal person with normal moods, as opposed to what I've remembered pretty much my entire life. Because I just felt stable. I was sleeping better too. I actually ended up having to go back to my doctor because I was on I was on so many medications. I was on a sleep aid, a mood stabilizer, antidepressants, all these kind of things. The first thing they took out was the sleep aid because it was actually making me drowsy during the day at this point because I was resting, and it became too strong. And then they started reducing other medications. And when I did actually fall off the diet, taking care of my grandmother, unfortunately, I had to go back on these medications.
Yeah, so clearly there's a dietary cause and effect that's affecting that, which to me it just makes sense. I mean, I can't imagine that human beings are designed to have bipolar disorder. I mean, I can't just be bad luck. There has to be something going on, whether it's trauma or whether it's nutrition. I think nutrition plays this huge role, and you and many others like you sort of confirm that on a pretty routine basis. And so, as far as medications, are you off all medications now, or what does today look like?
I just have one, and it's a dual medication because I have the migraines, the epilepsy, and the bipolar disorder. I'm on a very low dose. The only reason I'm a little hesitant to come off of it is because I have to drive a lot and stuff like that. And I'm just still a little concerned about the seizures because to me, even an absent seizure behind the wheel of a vehicle not only puts me in danger, but everybody else.
Oh, absolutely. Yeah. Absolutely,
and I don't want to quite chance that until I have a time period where maybe somebody can drive me everywhere that I need to go and I can test that out.
Yeah, fair enough. And I think that's pretty wise way to do that. So just as for sake of completeness, so your diet today, what does it look like?
I'm pretty much meat, salt, and water. Occasionally I get something else in it. I don't feel as good when I get something else in it. There are seasonings that I do react to. I did go on the Revero site and fill out the study.
Yeah,
I did participate in that. But there are very specific seasonings that I react to, and I kind of did that as a test for myself because I know when you go places, sometimes you just can't get salt on your meat, and so to me, I wanted to know what I could potentially tolerate if I went on vacation or something, and I didn't have access to cook everything that I needed to cook.
And what were you able to tolerate? Just out of curiosity, did you find anything?
I'm kind of okay with a little bit of onion, a little bit of garlic, but there are certain spices that if I eat them, they give me anxiety. They make me irritable. And I've even found this because I have some friends that use essential oils. If they have those oils in one of those essential oil machines, I feel the reaction to them as well. And they know to shut them off when I come in because they don't want to make me feel bad.
Yeah, interesting how sensitive some people are, and other people, don't seem to have any problem with it. To my knowledge, I don't know that essential oils bother me. I don't use them, but I mean, I haven't had any issues around them that I can recall. Do you find, and so, I mean, if we look at your quality of life, because I think this is an important aspect, your quality of life, whatever, 10 years ago, 5 years, whenever you were kind of in the midst of it compared to now, and somebody would say, well, you are increasing your risk for cardiovascular disease perhaps by just eating a bunch of saturated fat and meat. How does that calculation, how do you deal with that? It's my quality of life is so much better, I don't care, or I don't think that's an issue, or what are your thoughts?
Well, I actually have another very interesting thing. I have a congenital heart defect. I have a bicuspid aortic valve. Mm-hmm. So I have an echocardiogram done every few years. So everything is looked at and mine's perfect. In fact, my cardiologist said I'm probably one of those people, based on my age and current condition, that I will never have to have my valve replaced. Because mine's such in shape, my arteries are perfect, the blood's circulating perfectly. There's no enlargement of the heart. There's no stenosis anywhere. There's no clogging anywhere.
Yeah, I'm just wondering because they would have, with an echocardiogram, I don't know that you can assess coronary vessel occlusion, but you can certainly look at the function, the ejection fraction, the valve activity. Have they done mostly been echoes, or have they done some other tests in addition to that?
They have done a few. I've had the coronary artery calciums done, and that was 0.
Oh, good. Oh, good for you. How old are you, by the way? I can't remember. I didn't get that.
I'm 43.
43. Okay, so we expect it still to be low at that age, which is still good. It's still reassuring, though. Do you find that? When I met you, you have no problems with weight. I mean, you said you were 180, but you look perfectly normally fine to me today. Has that been? As far as like a lot of people struggle with when they go on diets, they struggle with cravings. I know, I was looking at a post that a guy named Spencer Nadolsky put up, and he was talking about, diet. It's, lunch is oatmeal, banana, and juice, and then breakfast is that, and then lunch is a chicken breast with some salad, and dinner something good, and then it's binge eating disorder at night because they're not getting enough food. Basically, they're not getting enough satiating food. How do you feel about that? I mean, do you struggle with missing foods or cravings, or what has the satiety like been with just the meat?
I feel very satiated on the diet. I was always somebody who really enjoyed meat. Anyways, it was always kind of my favorite part of any meal. And so the fact that I can just eat it is really wonderful. I am not as hungry during the day. I generally eat 1 to 2 meals during the day. Occasionally I'll have 3. It just depends on my level of activity, usually the day before or that day. But I'm not hungry, and I just eat, a pretty large portion, and then I feel full of energy for hours and hours on end. And it's nice. It's nice not to have to stop. And I see the same thing in my children because they're a heavy meat based, kind of a keto, low carb, no sugar. They occasionally have some other things in their diet, and they're the same way. They're not like a lot of children that I see that it's like you have to stop every 2 hours and give them something. They eat a big meal and then they go for hours.
Yeah, it's like a parenting hack. You just load these kids up on meat and eggs and stuff like that, and you don't have to hear about them being hungry every 15 minutes. I know when my kids are around, I just make them a big old meal, make sure they eat it all, and then I'm good. I've bought myself 6-8 hours of time where I don't have to constantly supply snacks. Let's talk a little bit about your kids, because you have a child, I think that's autistic, if I'm not mistaken, and yes. I know you've been using diet to help with that. So how did you decide to do that, and how has that gone so far?
So one of the things I've always been interested in how things work. Math and science were my favorite subjects. So to me, understanding how things work were important to me. I started doing research because I wanted to know why things were so different when I just went to straight carnivore versus low carb, why that was even more of an improvement, why it worked for my mental health and weight loss. So I had done the research, and of course, having children, I wanted to make sure that I was providing them with the proper nutrients that they needed to grow. So even though I was eating a pure carnivore diet, basically, I was feeding my children what I like to refer to as the standard American diet from over 100 years ago. I didn't have any seed oils or anything in the house. It was, butter, a whole milk. I would cook sausage or bacon in the pan, and then I throw the eggs in it and cook it in the grease, that kind of thing. Yes, there was some white flour. Yes, there was some sugar, but I didn't allow them to have a whole lot. At this point, my son was kind of what you would consider a high functioning autistic. You could see the autistic problems in him, but he was okay. He could communicate. I figured he'd need something along the lines of special education and maybe some assistance, but I had, hope that he'd be okay. What happened was I finally found the carnivore groups because I didn't know where I belonged. And the only reason I found that is because I was watching Ken Berry, and Dr. Berry decided he was going to do carnivore. And that's how I found the carnivore groups, because I didn't even know there were other people that were doing this. And I went to a meetup. This was, I would say, 3 years ago. And I left my two oldest children, which include my autistic son, with my parents. They were with my parents a little over 10 days, about 2 weeks. And my father, his dad, my grandfather, had died of a massive heart attack when he was 59 years old. And it was the year before I was born, so I never met him. So my dad was following the guidelines, low fat, high fiber, all this stuff, and didn't have really a fear of sugar, except he knew diabetes ran in the family, but as long as you weren't displaying any problems, you could have it. So they were using margarine, they were using canola oil and all this kind of thing. So my son was placed on today's standard American diet for nearly 2 weeks. When I got back, he had completely shut down. I picked him up at their house. He was not communicating in any way. He was laying in the floor. It was just terrible. I had to put his shoes on, basically carry him out of the house. At this point, he was almost 4 years old. And I thought he was just having a meltdown because he had to leave grandpa and grandma, and he loves my parents. And when I got him back to the house, what happened? He collapsed back into the floor, and he started just kind of flapping his hands like this, and he was rocking. And I rolled him over to try and get him to look at me. His eyes were rolling around in his head. He could not make eye contact with me, and he was just grunting incoherently. He was smacking his hands against his ears. At this point, I knew he was overstimulated, and I really realized what was happening, that he was just nonverbal. And I knew I had to go and get a hold of the doctor. So I gave myself a 20-minute permission to just melt down and cry, because I think every parent deserves to just have at least 20 minutes to react to a diagnosis of your child when you're really comprehending what's going on with them. I chose the carnivore diet because I knew it was the complete way to eliminate everything that he could possibly be reacting to. And I knew I had to get the carbohydrates out of him even more. But the thing that I was realizing was that even though they still had white flour and some sugar in their diet in my house, the natural fats, the higher level of animal protein, was actually somewhat treating his autism, because it was hiding the fact that he was nonverbal. And that was very interesting to me. Now, I know not everybody's going to respond the same way. Not every child's going to completely come out of it, but there is something to the diet and environmental factors that's obviously triggering my son's autism. Because when you remove that, he recovers.
To your knowledge, I mean, well, I guess maybe not, because you were feeding him kind of a, you know, like you said, a standard American diet from 100 years ago, which is far, far better than what we have today. Because a lot of autistic children do have gut issues, for sure. Not all of them do, but some do. And you know, when you fix that, it's very conceivable why they may see improvements in behaviors and things like that, for sure.
Yeah, he had some gut issues, and he had reactions to things, and I found that out because I nursed him for a month, and then it was a little stressful for me, so I thought, okay, I'll try him on some specialized formula because he was reacting to everything. I ended up having to relactate to feed him because he couldn't even tolerate any kind of formula. The only thing that we eventually found that he could tolerate was a homemade goat's milk formula.
Just a question about that. Relactating. How do you do that? I mean, I guess there's some hormones you could take or something, but how does that work? I mean, that's
a very complicated process. Luckily, I have a friend who is actually she's a certified lactation consultant. She was a labor and delivery nurse. She's retired from that now, but she still does that. And I just started researching it, and you just start trying to pump, and you have to do skin to skin contact to re-trigger the hormones and things like that. It's a long, complicated, involved process. My friend told me, she said most women don't get their full supply back, but I ended up doing that. I got not only my full supply back, I had an extra bottle. So I ended up actually donating what was left over when he was done to a friend that adopted a baby. So
yeah, I mean, there's a history of wet nurses, and I guess they're doing basically the same thing that women have done that traditionally. So it's just interesting. You just don't hear much about it used these days. But I guess with the formula crisis, maybe there's an alternative market out there for some relactation stuff going on. I imagine there's some women that do that, but interesting. So how did it go? Because a lot of autistic kids have really difficulties with food and textures and things like that. It's always a challenge. And just for the folks who don't know, I have an autistic child as well. My oldest one is a very high functioning, now 16-year-old autistic kid. And he is, unfortunately, he lives with me part-time, so I don't get to control his diet all the way, but he is very much eats a lot of meat, but he likes apples and milk. That seems to be like most of his diet, at least when I'm around. And he does pretty well. I mean, he's verbal, he's smart as can be, but he's just still got a lot of just stereotypical autistic social issues, I would say, at that point. But so tell me about the transition from taking a 4-year-old and removing all the flour and sugar that he might have. You know, he liked grandma probably because grandma gave him all these goodies and stuff like that. That's a lot of times grandmas do that to our children, maybe maybe not with the best result. But how did that go? How did you transition him?
I just pretty much yanked everything out. Now, in the very beginning, I wanted them to have something to look forward to, so I made a very small serving of a low-carb dessert for the end of the day initially, to just kind of give them a reward. It's like, okay, I'm sorry I'm taking away bread, potatoes, things like that, but if you eat this, I'm going to give you a dessert, so I did it as a reward system. And one of the things that I focused on with him, and the others were okay with that, I picked his favorite meats and I stuck with that. I wasn't a stickler for a particular type of meat. I just picked the ones that I knew he liked the best. He liked eggs, he liked bacon and sausage, and he was he loved chicken. So I focused on that initially, just to give him the things that he really liked. And I did season it just a little bit for them.
Yeah, I think that's perfectly fine. You got to you've got to get them to eat something. And my kids, they love sausage and they like bacon, and some of them like eggs, some don't. They all like steak. Every one of them. Well, it's funny. My one daughter is not as big of a fan of steak. She prefer chicken and hamburger. But it's kind of funny, so you do have to deal with that. So did he? This is what I'm sure they're going to be like, what was the dessert? So what was the dessert you gave him, just to, because I'm sure there's parents who are going to be like, what dessert did you give him?
Yeah, even though I know it's not the best and it's not something that I could digest, and I regret using it. I was using a little bit of almond flour and a little bit of coconut flour, and I was kind of just making these cookies. I had Dr. Eric Berg's cookie recipe. Okay. For the low carb chocolate chip cookies. And I don't know what size I was making. They were really small, and it was just kind of one. It was like, here's your cookie.
Now he carried a formal diagnosis of autism. You said he was diagnosed at, I don't know what age. Was it 2 or something like that? Typically it's about 2 when they get diagnosed.
Yeah, we could see some of the things happening when he was an infant. When he's basically, one of the first things that I really noticed was, even though my daughter was sleeping in the bed with us, I tried to have him in a crib. And when he started rolling and moving around in his sleep, he would roll. And when he touched something, it would wake him up. And it wasn't the normal cry that you hear from a baby. Okay, I'm awake. I need a diaper. I need some food. It was the I'm in pain scream. And it was different. So I was getting up every time he moved. And sometimes it was, I literally rock him back to sleep. And within 20, 30 minutes, I was back up. So after a couple days of nobody sleeping, I picked him up and finally put him in the bed with me. So I knew something was going on with him, because that's not normal. That's not normal for a child to wake up screaming with a pain scream. I'm in pain scream versus, I just need something kind of scream.
Yeah, sure, absolutely.
And that's what I'm seeing it initially.
So you get him through this transition period of, sausage, eggs, bacon, a little bit of almond flour for a treat once in a while. How does he progress with it? How does he adapt to that? And do you notice behavior changes?
Yes, there were things that he was almost 4 years old, and there were things that were told would probably be some delays, such as potty training and things like that. I started to notice he was coming out of it. Basically, he needed to be on the diet for 3 days before he was even coming out of the state that he was in, where you had to kind of pick him up and put him in a chair. He was just, the eyes were still rolling around in his head. He couldn't focus on anything. He was screaming. He actually had a fit and smacked his head into the wall and knocked his tooth out of his mouth and things like that. But after 27 days of being on the diet, he potty trained himself. And then he actually taught himself how to read. So what I was hoping to get back was the child I had before. And what I got doing a more restrictive diet was an even higher functioning, happier, more social child. Basically a normal child. There's a lot of times that you can see sort of still where he's had some problems, but a lot of times we actually, if something does happen, we actually have to tell people he's autistic now, because they don't even notice, because he kind of blends in.
Yeah, that's pretty amazing. I'm sure it makes you feel a lot better. And how old is he now?
He's 7 now.
7 years. So 3 years on the diet and developing relatively normally. Is he like small, or is he having any kind of nutritional deficiency things? Because some people would be concerned about that. Is he developing on the growth curve pretty well?
I'm not very tall, and his father was not very tall, but his father had some nutritional deficiencies growing up. His brother is actually half a foot taller than him. So he had nutritional deficiencies. So I always expected my children not to be super tall, even though my dad is 6'4", and that's kind of average for the men in my family. and I'm a foot shorter than my dad. But what I noticed was on average, they've all increased basically from, they were hanging around the 27th percentile on the growth chart for height, and now they're averaging somewhere around the 47th, 50th percentile on the growth chart in the past 3 years. So they've increased on the growth chart where they were maintaining in this lower percentile.
Yeah. Okay. Well, that's good. That's good to hear. I mean, I'm worried about they're in the bottom 5% or something like that. There's some issues,
Yeah.
so it's a failure to thrive and growth issues. So clearly, if they're in the middle of the growth curve, then that's a good thing. And how does he? Is he in schooling? Is he in a special school, or is he able to attend regular school, or what's he been able to do?
I started out homeschooling just because I was a little bit concerned, and then basically in the third quarter, which would be the third quarter, it was around March of this year, I went ahead and enrolled them in the public school system here, because we have a very nice public school system. I know a few of the people who actually work at the school, and he's fine. He does have physical therapy because he's a toe walker, and he has a little bit of occupational therapy there. But as far as the school system goes, he's in a regular class and he's not in any kind of special education.
Oh, that's really awesome. And is he? Is the school down with his diet? I mean, are they trying to push plant-based crap, or I mean, what do you say when he only eats basically a meat-based diet? How do they deal with that?
They're perfectly okay with it. They don't even care what you send. And in fact, one of their things is they have a snack, because it is a long school day. So they have a snack, and one of the things is they're always telling you don't send candy or whatever to the kids. Now, the teachers do give out a little piece of candy as a reward. So what I do is I send in basically a bag of the Lily's sugar-free chocolate chips, and they'll give them that in place of Jolly Ranchers or whatever they're giving out, M&Ms and things like that. And they'll give them that, and I'm okay with that as a reward. I would prefer no candy as a reward. Give them stickers or something like that. That's what we got. I remember there was really not a whole lot of special. You got an A. Congratulations. Occasionally there was something, but I send in and they work with it. So they're very open to it. And it's all in their medical file in the nurse's station too. No sugar and stuff like that. And I don't even want them drinking the skim 1% milk in the cafeteria either. But they have lactose intolerance, so that works. So you put that on there, and they're not drinking the regular milk, because we have the lactose free whole milk here.
Interesting. I was going to say my school was, if you behave well, you didn't get smacked in the butt with a paddle. It was a little different. So we were giving all these kids candies and stuff like that. Does he have enough insight at 7? Because I mean, it's still a pretty young kid to know that these foods are going to change his behavior and make him feel not so good. Does he get that? Because he's going to be in a place with all these kids, and there's going to be all this junk, and they're going to swap lunches and all these things. Does he have insight into that?
Yeah, he's learning. This is why I have actually added some things back. So I prefer your terminology, carnivore adjacent, as opposed to trying to get into hyper carnivore or anything like that, because I think that just completely confuses people because they don't really understand the terms. And it is confusing, because I know a lot of people that think hyper carnivore is the meat, salt, and water thing, because it's kind of what it would sound like to certain people. And so what I do is I've added some things back. And if he gets too much of the wrong thing, he knows how he feels. He starts to spiral downhill and go back into some really heavy problems. And we sit down and we discuss what he's eating. And he will actually check with people if they're offering him something and he refers to a dessert or something. He asks, does it have the bad sugar in it? Because I do still make some sugar-free style desserts, and he'll refer to it as the bad sugar. and things like that, and the bad food. And there are some times that he's eaten too much of a particular type of food and he's reacted to it and he gets mad and he'll say, I'll never eat that again. That's bad.
Yeah. Yeah.
Well, and I've done that because I want him to learn, because I've lost him again. I lost him for nearly 2 full weeks. He was completely nonverbal and shut down again. And it took the total of 3 weeks to get everything pretty much out of his system and kind of get him restored to the way he was. So I know it's not a cure. He's just reacting to this stuff.
Right. Yeah.
And so to me, it's important for him to understand and learn what he reacts to and how he reacts to it, because I don't want him to basically walk a chalk line in my household. And then when he turns 18, he moves out or goes off to college and says, okay, well, mom's not here to make me just eat this. Let me try this. And then he shuts down. And the only way I know is if he's living with somebody, then they contact me, or I get a call from an emergency room or a psychiatric hospital, depending on where they've had to haul him off to.
Yeah, you said you lost him a second time. Was this outside what happened in Grandma and Grandpa's house? How did the second sort of thing happen?
The second thing was, and I don't like to get into a lot of arguments with people, but I had taken him to a dentist appointment, and they put all 3 of my children in one chair together. My youngest, they couldn't get him to open his mouth because the lady wouldn't. He just didn't want to cooperate with the lady. And of course, I was a little bit concerned about my autistic son, how he would react to this cleaning. And then, so they had all 3 of my children in separate chairs at the exact same time. And I was running around this dentist office, and the dentist said, can we do the treatment? And it didn't even dawn on me that we don't use fluoride. I react to fluoride. Fluoride gives me insomnia, so I just don't use it in my household. And we have well water, so it's not treated with fluoride. And they did the treatment. Within 20 minutes, that's when we were leaving the office after the fluoride treatment. He was walking sideways through the parking lot. He wasn't even walking towards our vehicle. And I had to grab him. I had to refocus him. I got him over to the vehicle. He would not get in the vehicle. I picked him up and I put him in his car seat, and he just slumps over like this. And he shut down completely. So the fluoride treatment, he reacted to fluoride, and he was nonverbal, reacting the same way. He actually knocked another tooth out of his mouth during the fit. So we ended up back at the dentist office within those 2 weeks. But it took 2 weeks to get him to come out of it instead of 3 days like it did the first time. So it was 2 weeks before that was clearing out of his body, and then another week or so before he was really back to where he had been.
Yes, interesting.
So that was a pretty rough time, and I was just grateful at that point I was homeschooling, because I would have no idea how to explain that to the school system, that a child that they had seen the day before or that day that was normal is now basically comatose in the floor, flapping their arms with their eyes rolling around in their head.
Wow. Yeah, that's got to be distressing for both you and for him. It's interesting because I remember when I got fluoride treatments as a kid or as an adult, I remember they just tasted really bad and had different flavors. And I wonder if it would be like cherry, and it always tasted like really gross. But I just wonder what else was in there, if it's the fluoride, if it's some of the other ingredients in there. But certainly fluoride could be the issue.
Yeah, I don't know what the other ingredients are, but I just know that we don't use that. And I know that if I've had to use fluoride toothpaste because that's what was available or whatever, I do start to get some insomnia myself from it. So I have a little bit of a reaction to it, just in general myself.
Autism, as you probably are well aware, is becoming increasingly more prevalent now, whether it's, a wider net with the diagnostic, widening the net, or it's just actually increasing. Most of the data seems to indicate that it is increasing. I think the last one I saw was like males are it's like 1 out of 35 males in the United States right now are diagnosed on this autistic spectrum, which is shockingly high. Do you get any other parents that have contacted you? Because I know you have a social media and I think you talk about this. Have other parents reached out to you, and have you had any interaction?
Yes, I have had interactions with other parents, and it's they're not just necessarily autistic children, but children that have ADHD and things like that. I have over a number of years worked with people on the side for various reasons. Sometimes they are parents and things like that, and I've just kind of walked them through the process. And I said, if nothing else, just start with removing the added sugars and things like that from the diet and just see how your child reacts. And I know one of the things is the gut issues. And most of the time when I've talked with a parent whose child is on some sort of a spectrum, they've always had some sort of, they're allergic to something. It's corn, wheat, or something like that, and they've had a gut issue, and they've been on some sort of an elimination protocol, or they're even allergic to these things. And that was just a common thing that I found.
Are you getting a sense that, because it's nice, it's wonderful that your child has improved. Have you seen this happen with other kids as well, where they see an improvement? Do they tell you, hey, I did this and my kid's behavior is improved, is autistic? Some of the stimming, perseverations, all the stereotypical behaviors are improving. Have you seen that?
Yes, and some of the people I'm not even, they don't even live near me. I've met them in other carnivore groups and stuff like that, and maybe the parents in the group for various reasons, and then I find out that their child has it, and I walk them through even an adult child that they can convince to that's still living in their home, that they can convince to just add more meat and reduce the sugar. They start seeing improvements just in general.
Yeah, there is a group, a Facebook group called the Autistic Carnivores that a friend of mine, Tom Clark, runs. And I don't know how many members. I know they had several hundred at one point. I'm sure it's increased by now, but that's a resource that some people use. Let me ask you, with a child, and you see the dramatic change in difference between him being on a meat-based carnivore adjacent diet versus really anything else, I would imagine. Do you have concerns when people say, hey, we think we need to cut back on meat, and maybe we're going to sort of dictate that we go on more of a plant-based diet? Does that concern you at all? And how would that impact your child?
Yes, it does, especially after doing the research that I've done and just seeing what nutrition the body actually requires and what the sources of those particular types of nutrition are. And the only thing that I found that basically has every single component that you absolutely need are animal-based products.
Yeah, and like I said, if say your son were, for whatever reason, let's just say this dystopian reality becomes a reality where you're limited to having meat once a week as a treat, what would they do to the quality of your son's life?
It would destroy the quality of his life.
Yeah.
It would. He would go back, because I've seen what happened. It would destroy the quality of his life if he did not have the appropriate amount of animal products in his diet, and he was forced to eat other things that just didn't agree with him.
Yeah, and he's not alone in that. I mean, there's a lot of people where quality of life would be much worse. Does it, you'd mentioned bacon and eggs and sausage and stuff like that. Some people will say, well, you have to, in order to get benefit, you have to eat only grass-finished meat and, this type of stuff. Has that been the case for you or your son?
No, I do enjoy, I do think there's a little bit different in the grass-fed and grass-finished. I have friends who own a cattle farm, and I can get some from there. And I do buy that when it's on sale, because occasionally it is cheaper at the store when they do the sales to buy the grass-fed and grass-finished when it's on sale, as opposed to the standard. And and I do appreciate that there's a lot of places now that are doing that, because I'm very much a supporter of regenerative farming and things like that. And I'd love to see just all the animals be able to live out their life until it's time in a nice, happy environment, even though I know they're not being tortured, despite what some people say, if they're being grain finished. It's not a big deal, but I do feel a little bit of difference if I eat that consistently for a period of time, the grass fed, that it's just a little bit better. But I'm not worried about specifically getting that.
Yeah, fair.
It's not something that I worry about. I just basically try and focus on getting the actual meat, the eggs, and things like that to feed him, because I know it's the best.
Yeah. Sure. And does he, I mean, sounds like, is he got plenty of energy? Does he running around like a normal kid, doing all the kid things, going out and playing? And, does he get enough food?
Yes. He eats plenty. He's full of energy, and just to tell you, and like I said, I know every child's going to react differently. Every adult's going to react differently. It's not going to be, not every child's going to come out of it like my son did. Not every person who has bipolar disorder is going to respond the way I did. But my son, from a child that was sitting in the floor, that couldn't make eye contact with you, that was grunting and couldn't talk, to a child that's actually participated in plays and had speaking parts, that's a major difference.
Yeah, that's awesome. That's got to feel good. I mean, in many ways, it's just, we kind of take for granted we have a child we think is going to be healthy, and when it's not, it's a lot of emotional investment in that, and to see that you can find some, because what was your sense from like pediatricians and other people that probably you met early on, as far as what their strategy was going to be? Did they talk to you about nutrition? Was it mostly just here's a stimulant or something? I mean, a lot of kids on autism are put on stimulants. I mean, was there any discussion around nutrition with that regard?
They were just kind of watching him to see how he developed, because they wanted to see the symptoms, and obviously the diet that I was feeding them was masking a lot of the symptoms. But the one thing, the pediatrician that I had, he wasn't really a pediatrician. He was a family care, because he treated the entire family. When I took him back in and was explaining, what we did, because he obviously saw where he really went downhill pretty much. And then when he was doing better, he's, okay, what are you doing? What's going on here? And I was a little nervous about telling him, because you always hear these things where the doctors go into full-blown panic mode. So I told him pretty much exactly what I was doing. And he looked at me and said, I'd rather change his diet than medicate him. And I almost hugged the doctor, because that's not what I was expecting based on the horror stories that you hear.
Mm-hmm. Yeah, that's good. That's good, because there are a lot of horror stories, and a lot of folks that don't have an interest in that. Allie, we're unfortunately running out of time, and I know there's a lot of stuff. And thank you for sharing this. I mean, I know it's a lot of stuff with both you and your son and other kiddos. Where do people go to find out some more about either your journey, or maybe if they want to talk about their children with autism, ADHD, or whatever it might be?
One of the best places to find me is just on Instagram under Allie Carnivore. You can message me and things like that. I'm kind of hoping maybe to get an individual group going somewhere for children, even if it's in the current group I'm in. Right now, I am helping coach a little bit in the Carnivore Fix, which is Dr. Anthony Shafee's group, basically. And I am doing some things in there.
Good for you. Awesome.
But messaging me is fine, but I kind of like to get basically kind of a support group for parents of children with various things. So they can talk with me. They can communicate with each other. So I'd like to get something up and running when I can.
Yeah, you learn a lot. You learn a lot along the way as a parent. You know, you're doing it for a few years where you get somebody that's brand new and they don't know what to. So it's very confusing. I remember when our kid got diagnosed, it was a lot of distress and what the heck you do and that type of stuff. So it's good to have somebody that's been through it. So, Allie, thank you so much. The rest of you guys, thanks for being here. We'll see you soon. I think I'm actually gone tomorrow, so I've got to fly to Monroe, Louisiana to meet one of our investors. So I will not be here tomorrow, guys. You guys have a great day. Thank you so much, Allie. Have a wonderful day. Good luck to you and your son, and let's check back with you down the road if you don't mind.
Sure, not a problem. I'd love to.
All right, thanks everybody. You guys take care now. Bye bye.